We are going to talk about heel pain, and the first heel pain condition we are going to speak about is plantar fasciitis. So do you want to explain to our viewers what is the plantar fascia?
Fascia is a thick fibrous band which originates from the heel all the way to the plantar plates of the MTPJ.
Okay, can you show us on your model, please?
Yeah, so this is where it actually originates from the heel part, and it just inserts into all these lesser toes.
And what's the function of the plantar fascia?
So the function of plantar fascia is that it acts as a shock absorber when we're walking and running, and it helps us maintain the arch as well.
So tell us about plantar fasciitis now. We know that some people like to use the word plantar fasciitis, some people like to use the word plantar fasciosis. So first of all, can you tell us what plantar fasciitis is and what plantar fasciosis is?
So plantar fasciitis is, itis mean inflammation. So originally it was thought that plantar fascia gets inflamed predominantly at the insertion part of the fascia in the heel area. However, later research have actually shown that there isn't any inflammation there at all. So it's more of a thickening. So the term have actually evolved and become plantar fasciosis or plantar fasciopathy.
Now, it's one of the main causes of heel pain. Now, it's not the only cause of heel pain. There are many causes of heel pain. But if we talk about plantar fasciitis or plantar fasciosis, depending on who you're speaking to, can you tell us what are the main symptoms that a patient will complain of regarding when it comes to this condition, rather?
Okay. The most common symptom that we tend to actually hear from the patients is that sharp shooting pain first thing in the morning, or when they've been sitting down for a long period of time, and as they stand up, they get sharp shooting pain, which eases off with activity. So as soon as they start walking, it starts to basically ease off. If you've got chronic plantar fasciopathy, in that case, the pain can start to be worse in the morning and eases it off, but it stays there. That's chronic pain for all the activities.
Now, we've spoken about the symptoms, the main symptoms. Are there any occupations or activities that may be more inducive of getting this type of foot condition?
So anybody who's on their feet for a long period of time, so people who work in customer service where they are on their feet for like 8 to 12 hours a shift.
And does it make a difference on the kind of surface that you're walking on?
Of course it does. The harder the surface, the more the loading on the plantar fascia, and the risk factor increases with that.
So, are there any lifestyle choices that people can make that can lead to plantar fasciitis or plantar fasciosis?
So research is quite clear with this, that increased BMI is linked with...
Can you just explain to our viewers what the BMI is?
So increased weight is linked with developing plantar fasciopathy, or one of the causes which can contribute to a development of plantar fasciopathy.
Great. Now, we've talked about what plantar fasciitis is, and we've talked about the symptoms that people get. We've talked briefly about the causes when we talked about weight and the BMI. So are there any foot structures that would make a person potentially more likely to get plantar fasciitis or plantar fasciosis because they're putting more strain onto the fascia?
Yes, there are certain structures which can contribute to a development of plantar fasciopathy. Patients with extreme pes cavus or pes planus foot type can develop plantar fasciopathy.
Let me just interject now, because you're using words that some of our viewers may not know. So what is pes planus?
So pes planus is a flat feet, and pes cavus is a high arch.
High arch. Now, a really important question to ask: does everybody with flat feet or high arch feet will they all get plantar fasciopathy?
No, not at all.
So, are there any other causes of plantar fasciopathy that you can tell us about?
So there is good evidence to show that if you've got tight calf muscles, soleus or gastrocnemius tightness, can lead to reduced ankle dorsiflexion, which is the ankle's ability to basically move upwards. That can contribute to a development of plantar fasciopathy.
Now, we all know that the foot and the leg isn't working in isolation, so it's part of the entire body. So would the hamstrings potentially play a role in that too?
Of course they can.
Yes.
So it's everything is interlinked.
That's right.
The way we move, tight hamstring, tight calf muscles put more pressure onto the plantar fascia,
That's right.
increase the loading in plantar fascia. Hence, there is increased sensitivity of plantar fascia, and you can feel the pain.